Thank you all for being here on a Wednesday morning to talk about a pressing issue that is facing us right now, the unsustainable cost of being a parent in Michigan. Over 1.7 million households don't earn enough to pay for everyday necessities, and that's even for families without young children. With kids in the mix, it can be near impossible. As a mom of a little one myself, I look back and marvel at everything that my own mom did to raise 4 of us, knowing that for far too many parents right now, it's simply beyond reach. For far too many, raising a child has become a financial headache and a constant source of worry as they struggle to keep up with rising costs. And this has a profound impact on the health and well-being of parents, our kids, and our economy. It's important to be clear about how we got here. 5 years ago, right at this time of year, we entered a global pandemic that would upend everything about normal life, including our economy. While the pandemic is thankfully behind us, we still have lingering supply chain issues, stubborn inflation, and the cost of everything from diapers and formula to childcare and housing has risen astronomically. Prices not only remain high, but are continuing to increase. Recent polling has found that 2/3 of parents report being consumed by worries regarding money, and a quarter say they are unable to provide enough food for their families or pay their rent or mortgage. When families can't afford the basics, businesses have fewer customers. That cuts into their profits, making them less likely to invest and hire, which means fewer jobs here in Michigan. And that brings our entire economy down. One of the major reasons families have not recovered from the devastating impact of the pandemic is because we lack the infrastructure to adequately support parenthood. Senate Democrats are in your corner. Last term, we quintupled the earned income tax credit, repealed the retirement tax, ensured no kid goes hungry at school, and much more. But we're still up against a system that has ignored the financial struggles of parents, instead prioritizing the needs of billionaires and big corporations when decades of research shows instinctively what we knew. Trickle-down economics simply doesn't work. It's abundantly clear that the status quo is not working. A true fix requires bold, transformative set of policies, which is what we're here to lay out today. My colleagues, Senators Hertel and Santana, as well as community and policy leaders, are here today to talk about our plans to provide the building blocks Michigan needs to uplift working families and ensure they have a fair shot at a better quality of life for themselves and for their children. We built the middle class here in Michigan, and our prosperity has always and will always come from an economy that's designed to put you first. Now it's time to step up again to create policies that reflect our values and strengthen our workforce and ensure you have the opportunity to thrive. With that, please welcome my colleague, Senator Hertel.
Thank you, Senator McMorrow, and good morning, everybody. Thank you for being here today. I stand here today not only as a legislator, but I also stand here as a father. My wife and I are raising 2 young boys. And just like other parents, when my wife and I are not running between school and sports practices, we ourselves are working and running other errands to keep the household going. And between the groceries and the gas and childcare, doctor's visits, and so much more, the costs continue to add up. It's a constant balancing act with prices of everyday necessities continuing to rise, and we know we are not alone in this process. Now, I've always taught my children that if they put in their effort and play by the rules, they will succeed in life. And I genuinely think that that should be the case. Anyone who works hard should be able to raise a family and get ahead in life. But the reality right now is a lot of parents are struggling just to get by across all of our communities. Between inflation, the skyrocketing price of childcare, the cost of raising a child is more expensive now than ever. In the first year alone, raising a new baby costs more than $20,000, a staggering amount that is more than 1/3 of an average of a U.S. family's annual household income. I think any of us would have a challenge finding an extra $20,000 in any of our budget. And families across our state today are struggling to get by with those numbers. As a result, we're seeing parents' stress levels rising, more families falling below the poverty line here in the state of Michigan. And that's not good for the well-being of us, our parents, our kids. It's not good for the well-being of our state. If we're serious about growing our population here in the state of Michigan, we need to get serious about making parents a priority and building on an economy that supports them and their families. They need more than just budget hacks. They need real solutions, and that's what we are here proposing today. You know, back in 2023, my colleagues and I passed a historic expansion of the Earned Income Tax Credit here in Michigan to help put over $3,100 back in parents' pockets across the state. But that was only a start of the work we needed to do. There is so much more that we can do to help these families today. While we see Republicans in Washington stumbling over themselves to give billionaires for those who need it most and deserve it most, and that's working families here in our state. Our proposed working parents tax cut would provide an additional $5,500 to parents with children under the age of 3. The credit would both be easy to apply for and easy to qualify for, with eligibility based on the existing Earned Income Tax Credit metrics. Having the potential to serve hundreds of thousands of households across our state, this proposal would help parents keep more of what they earn in their pocket, making it easier to afford the everyday essentials from diapers to daycare costs. The tax credit would also drive local economic growth and promote better education and health outcomes for babies and kids across our state. Ultimately, when we let parents keep more of their hard-earned money, it gives everybody a better chance here in Michigan to succeed. And the positive effects of this extend far beyond just a family household. This is the type of policy that works to uplift entire communities, which is why there's ground-swelling support from over 80 businesses, nonprofits, faith leaders, including Democrats, Republicans, and independents here in Michigan. We all know that this will help families across our state. And now I'm excited to welcome to the podium Allison Fries, who is the president and CEO of The Source. She will speak on the Parents Tax Credit and coalition support.
Thank you. My name is Allison Fries. I'm the president and CEO of The Source. I'm also a mother myself. I'm happy to say that those childcare days are behind me, but I can say for the 10 years that my husband and I were paying for childcare expenses for 2 children, in the early days, it was really hard as a young working family to be able to write that check every week and ensure that we could provide that care and pay for other things that we needed in our household. At The Source, we are a nonprofit employee support organization. We provide wraparound support to help people reach stability in their lives, and that allows them to be able to maintain employment and grow in their careers. We are helping people every day navigate challenges around housing, transportation, childcare, food insecurity, and various financial needs. We work in partnership with more than 25 employers in the region who recognize that having this critical support is able to help them to maintain the workforce, and we can share those really critical insights to be able to improve their internal policies and practices that they have for their employees. Many families in Michigan, as you've heard already, are struggling to pay for basic necessities like food, housing, transportation, and others are getting by in the day-to-day, but if they have an unexpected expense, they do not have the emergency savings to be able to pay for that. And that then puts them behind on other bills, and it turns into this downward spiral and can cost them up to their house. And we've seen that happen here in the state of Michigan. We know that the first 3 years of a new child's life are considered the most expensive. You heard an estimated cost of roughly $20,000, with childcare costing an estimated $11,000, so just over half of that going towards a childcare expense. Diapers, the formula childcare, it all adds up. And many families, unfortunately, have to then make the decision, are both parents going to work? And unfortunately, for many single-parent households, there is not that choice to make. One of the services that the Source has offered is free tax filing for households earning less than $65,000. We're in our 21st year as a VITA tax site, and when the earned income tax credit last year increased to that 30% state match, we saw an immediate relief for working families. We witnessed the relief on clients' faces when they learned that the increase in the refund and what that would mean for their families. For some, they shared with us that they were planning to get caught up on basic necessities because they had fallen behind on bills like rent, utilities, car payments, or insurance. And others told us about their intention to pay off debt, schedule a medical procedure that they had been putting off, completing a home or auto repair that they had not previously been able to afford, buying their children new snow boots or school supplies, or putting the money in the bank to establish an emergency savings account. The earned income tax credit was a really great step forward, but we know it's not enough for working families. More support is needed in order to achieve stability. The working parent tax credit in the support of cash and not a program allows for greater scale to reach more working families, and more importantly, it puts the trust in the families to make the best decisions for themselves with that money. And we truly believe that that is critical. We know many from talking to the clients that we serve would intend to use that on childcare or pay for other critical bills in their household. This means that parents, mainly women, would re-enter the workforce if these dollars allowed them to cover the cost of childcare. This would be beneficial for our employers across the state who are struggling to fill roles and have a positive ripple effect into the economy with more dollars being spent on childcare and other items in our communities. This could be life-changing for many families, allowing them to build a stable foundation that enables them to achieve economic stability and mobility for themselves and pass that along to their children. For the past several months, I've been fortunate to be a part of the steering committee for the Working Parent Tax Credit Coalition. This coalition is a group of over 100 leaders and growing from various organizations across the state, and we share a common goal of wanting to see greater support for working families. Last year, we co-authored a letter to the governor and to our legislative leaders calling for a large refundable credit direct to working parents to help them with childcare and other critical expenses. So I'm really happy to represent that group today. We really believe that Michigan has the opportunity to be a leader across the country in these efforts. And now I'm going to turn it over to Senator Santana.
Thank you all for being here today. To every parent juggling work, caring for little ones, and making ends meet, we see you, we hear you, and we are here for you. Raising children, especially a newborn, has become unbearably expensive. For too many, what should be one of the most joyful times in a family's life has become a financial struggle. That's why we are here today to begin the work of expanding RX Kids, the first in the nation program already making a difference right here in the state of Michigan. I know Dr. Mona will provide deeper dive into the program, but here is what you need to know. RX Kids provides financial assistance to new mothers during pregnancy and throughout the baby's first year of life. It launched in Flint, and the response has been overwhelmingly positive. We've heard directly from mothers about the difference this support has made, allowing them to spend more time with their babies instead of picking up extra shifts. RX Kids has helped mothers effort to afford diapers, formula, and childcare without the constant stress of making ends meet. As a parent myself, I understand these challenges. I have 3 children, and they are older now. And I've also know firsthand how that cost of diapers, formula, and childcare has only continued to rise over the years. A program like RX Kids would have been a game changer for my family when my children were little. I also know that many families feel the same way. That's why, as the chair of the Department of Health and Human Services Appropriations Subcommittee, I have worked with also Senator John Cherry and my other colleagues to make sure that we secure funding in the state budget to help get this program started. And we've already had tremendous benefits for families in this Flint area. And this year, this program is going to expand to Kalamazoo counties as well as the eastern Upper Peninsula. But we cannot stop here. Financial challenges don't stop in cities or counties. But I've heard from other mothers in my district as well, who also are doing everything imaginable, planning, saving, and budgeting, yet still struggling to keep up with the ends and meeting. They need more support. They need this program, and we need to provide it to them. Now it's time to take the next steps. With the Senate Democrats' new plan, we have an opportunity to expand RX Kids statewide and ensure that every family, no matter where they live, has the building blocks they need to thrive. I look forward to working with my colleagues and community partners, and of course, the visionary leaders behind this, like Dr. Mona Hanna, who I'm now pleased to introduce. Dr. Mona.
Thank you. It is amazing to be here. Thank you to all the senators for their leadership. Thank you to Governor Whitmer, who has championed this program. Thank you to Senator DeMoose up in the Upper Peninsula, Northern Michigan, who's also been a champion of this program. It is so exciting to be here, and it's so exciting to hear everybody repeating what we all know. The hardest job that our families have in Michigan is to be a parent. It is so hard to be a parent. I am a practicing pediatrician in Flint, Michigan, and for so long I have wished for the ability to help my parents, my families, with one of the hardest things, and that is to overcome poverty. When babies are born into and grow up in poverty, it is a pathogen. It makes kids sick. It impacts their entire life course. It impacts their potential. Yet we don't have to do that anymore. And we're not doing that anymore thanks to the leadership of these amazing folks. As was mentioned, RX Kids is a prescription for health, hope, and opportunity. It started in Flint over a year ago. We have prescribed over $7 million to over 1,500 families in Flint. And those dollars are going to exactly what you heard. They are going to baby supplies. That mom-baby period, that time of pregnancy, infancy, is the poorest time in the life course. Towards the end of pregnancy, moms often have to come out of the workforce. We have no paid leave policies in this country. Babies are expensive. We've heard that. Babies need so much stuff. It's like the smaller they are, the more stuff they need, up to $20,000 in that first year. And during childbirth is actually the poorest time in the entire life course. Can you imagine when our families are having a baby is when they will be poorest in their entire lives? And that is the most critical time of child development. What happens in that brief window of that maternal infant period shapes your entire life course. That is when we should be surrounding our families with resources and love and enrichments to make sure that they can grow up healthy and successful. And that's exactly what RX Kids is doing. Families are using this money. It is a proven, effective, and efficient program. They're using this money, number one, for baby supplies. And when you break down baby supplies, it is diapers, and it is wipes, and then it is feeding supplies, and then it is changing things. Then they're using it for rent and housing and food and transportation and childcare. And this is all based on global evidence. 70% of countries do some sort of child cash transfer. We did it in this nation during the expanded child tax credit of 2021 when we dropped child poverty to its lowest level. So this work is not rocket science. This is basic. This is how we care for each other in a society. So in Flint, we have near 100% take-up, which is amazing. Every mama and baby that should be in this program, that is eligible, is in this program. We are seeing massive improvements in housing stability. We had no evictions among low-income families, which is amazing. Improved food security, improved maternal mental health, a decrease in postpartum depression, improved well-being. Our families feel less stressed, more loved, more valued, more respected, more empowered. They have more trust in government and more trust in healthcare, which is really amazing to be from Flint for our mamas to say they have more trust in healthcare, but they do because of this program. And then based on big data from vital records, birth certificate data, our mamas have more prenatal care. They're coming to prenatal care earlier. They have less smoking in the third trimester. We have improvements in birth weight and gestational age. All these things that have been so hard to move, we are moving because of this program. This program is working. It is effective. It launched in Kalamazoo less than a month ago to tremendous success. It launched in 5 counties in the Eastern UP a week ago with already 150 folks enrolled in the Eastern UP. There is not a day that goes by where I don't hear from somebody from the other parts of our amazing state that say, we want this too. We are struggling. I'm a teacher in Grand Rapids and I can't make my ends meet. I'm a single mom in Bay City and my family could use this too. So I applaud the leadership here for recognizing that we can easily expand this absolutely efficient and effective program to every mama and every baby. And before I close, I want to introduce you to Rex. This is the official ARCS Kids spokesbearer. Thank you so much.
Thank you so much, everybody, for being here today. You heard just some of the incredible stories from 2 of the providers in our state who are doing such great work for our families. Anybody who is a parent knows that you would do anything for your child. And these are some great tools ahead of us that will allow more parents to be able to focus on being a parent and doing everything they can for their child. With that, we will open it up for a couple of brief minutes of questions. Certainly. So we are starting the budget negotiation process at this moment. Part of the reason for having this press conference today is to really lay out a vision for the public. We know how popular and successful this program is, and we want to let people know this is what we are fighting for as a stark contrast to what we are seeing come out of the State House right now, and this will be a big part of budget negotiations moving forward.
House Republicans just passed their income tax proposal yesterday. I think that just makes me want to ask, what are you willing to give in order to get?
As we mentioned, this is the start of the budget negotiation process. What I think we are all very glad to see is that our House Republican colleagues also understand the importance of childcare and families, and we look forward to a robust negotiation.
Do you think that this would be more beneficial than a tax cut?
That is part of negotiations. I think, as we mentioned in remarks, what we know is trickle-down economics doesn't work. And at a moment when the federal government is prioritizing tax cuts for the wealthiest 1% of Americans, what we are saying to Michiganders is that here in the state of Michigan, Democrats want to fight for tax cuts for you, not people who don't need them.
Is the tax credit proposal for parents of young children the same as what was introduced last session?
It's very similar to that. And just to the previous question, I would say that puts directly $5,500 back into the pocket of a parent or a family who has a child 3 years or younger, right? We know that the income tax cut that has been discussed in the House doesn't put anywhere near that amount of dollars back into a family that needs those dollars at a time when, as you heard today, the first year of a child's life is $20,000 to that family. I've lived through it. I've been through it. It's challenging. And so we know this will have a much greater impact, I believe, than what they're talking about there. I'm sorry,
So
Craig.
just one follow-up on that. So I'm looking at the fiscal analysis of the bill from last session. They said that proposal would cost $900 million to $1.1 billion. You have the House proposing shifting $3 billion in current revenues to roads, talking about an income tax cut. How will all of these things fit together? Because it doesn't seem like there's enough money to do all of these things.
Well, I would say, we know that a budget is a statement of our priorities. And regardless of political affiliation, I think every one of us has people in our communities that will benefit from these policies that we're talking about today. And this gets the support and the help directly to the people that I think need it most here in our state. And so I think we need to have that conversation through the budget process and make sure the budget is reflecting our priorities. And I think these policies that we're talking about here today are our priorities that we want to set forward.
If I can just add, any investment in early childhood has a massive return on investment. For something like ARCS Kids, it's a trickle up program. Those dollars get spent locally, so it's an economic development program. But also in the long run, you have less costs in child welfare because it's preventing child welfare involvement, less abuse and neglect. You have less Medicaid costs because you have less NICU admissions and premature babies and all these other health complications that we're not going to have. You have less costs in special education and criminal justice. Those societal savings may not be seen right away, but any investment in early childhood reaps a massive return on that investment.
We are coming up on time for session. If there's one more question, we can take it. Otherwise, we'll break out for one-on-ones. Dave, you want to take last question?
Just a follow-up on the budget. Do you have any concerns given the cut, potential pauses and potential cuts at the federal level about taking money, $1 billion out of the state budget?
So we've been talking about this a lot. I've done multiple events in my community over the last few weeks. I know my colleagues have as well. And what we've seen is a flood of people who are anxious and concerned. Our state budget is made up 42% of federal dollars, which is our tax dollars that we pay to the federal government that we expect and rely to come back into our state. So what we are encouraging everybody in the public to do is, as you hear about programs like this or potential cuts to programs in your community, whether it be education funding, we know that $2 billion would be lost to our school education funding if the Federal Department of Education goes away. Contact us, share those stories. We just had an oversight committee hearing talking about some of the impacts of federal cuts, and that has to be what we prioritize moving forward. We've also seen the federal government very quickly rescind on some of their threats when they've heard public outcry. So what we are here to say today to parents all across the state of Michigan, if this is important to you, tell us and tell your elected officials all across the state not to cut funding for these federal programs.